With StraightSmile Solutions, StraightSmileSolutions.com, and today I want to talk to you a little bit about scarring or white spot lesions on teeth after braces. We call that decalcification, and that basically is like a baby cavity. It's a pre-cavity, and it's like a scar that your tooth can get if a lot of plaque with the acid sits on the tooth for a long time, and you've probably seen people with that kind of mottled teeth. It's more likely to get a cavity in the future. So it's one of those things, of course, we want to prevent from permanently happening, but occasionally, like a patient disappears, or, it's one of those patients that, um, you know, maybe they just for a long had a bad couple weeks and they didn't brush their teeth and it can show up. So, anyways, I want to talk to you about a product called Opal. I think it's called Opalustre. Am I looking at this right? Yeah, Opalustre. Opal and then Luster all put together. It's basically the best thing I've seen for removing these scars. It's not going to like 100%, but it's just going to improve it. So it's not quite as noticeable. Um, Another option is to bleach the teeth, but to me that usually makes it look more chalky. So it's basically the Opal Luster kit is made by Ultradent. I've seen some good cases. It looked decent. So improved is the way you're gonna call it. I'm not sure how much this kit is. I know it's enough for 4 patients. It's usually something a general dentist says because I consider this whitening, and whitening is not something that I, as an orthodontist, not that I can do it, but I consider it kind of stepping over the line. I wouldn't want, there's a line in there. You're just being polite to my general dentist. I like to refer that kind of cosmetic stuff back to them. So, yeah, I've never done it, but I've seen cases is basically what I'm trying to say. So it's a combination of like acid, like a heavy, strong acid, plus like a microderm abrasion, like an abrasion of the top teeth, and then polishing. So it's almost like an IPR of the tooth itself, the front surface layer. You're opening up the pores and then you're polishing it. I don't know if that makes any sense. So you are removing, I think it says 0.2 millimeters of enamel, the front side of the enamel, so not in between the teeth, right? But yeah, I think it's a great thing to consider. I definitely would charge for that treatment, kind of like I would charge for maybe whitening, maybe a similar price. So it's going to be over the counter. But at least there's a solution if somebody's really sensitive about it. So again, this is called Opalustre, and it's by Ultradent. And Ultradent, you're welcome to send us a sample if you want us to review it in person and do an unboxing. All right, thanks so much. Hey, this is Dr. Amanda from StraightSmile Solutions, StraightSmileSolutions.com, and today I want to talk about white spot scars, decalcification, or those little spots that sometimes people get on their braces on their teeth after they get their braces off. And they're basically like baby scars. They're like baby cavities, and they look like scars, like white. They're whiter than the regular tooth. And it is a permanent thing, but you can polish it off with this kit called Opalustre. I'm a orthodontist, so I don't do whitening. So just not polite, I think. So I like to send the patients back to the general dentist. That's their land, and this land is your land. This is my land. This is my land. So yeah. But I've seen patients that have had it, and it looked really nice. But it's basically like a combination of etching and microabrasion of the surface of the tooth. It removes 0.2 millimeters of enamel, so it doesn't hurt or anything like that. But I mean, it certainly is something you need to do at a slow speed, so you can't do that at home, which is good. I wouldn't want people doing that at home, taking off the surface of their teeth. I don't know what the lab fee or the cost is for the kit, but I know the kit's enough for 4 people. I think most people charge a couple $100s for the procedure. So, anyways, that's just my review because I didn't see like much on it on YouTube about it, and people are always asking me. All right, thanks so much.